In this module, we will be discussing the scene size-up component of the patient assessment process. Upon completion of this module, you should be able to recognize potential scene hazards, describe common hazards found at the scene of a trauma or medical patient, determine if the scene is safe to enter, define the concept of standard precautions and the need for personal protective equipment, discuss common mechanisms of injury and nature of illnesses, describe the methods to manage hazards at the scene, discuss the rationale for considering the possible need for early C-spine precautions in the patient assessment process, and explain the reason for identifying the need for additional help or assistance. You will also be able to explain the rationale for crew members to evaluate scene safety prior to entering a scene, and you should be able to serve as a model for others, explaining how patient situations affect your evaluation of mechanism of injury or nature of illness. The scene size-up for every EMT begins with notification of the emergency incident. The EMT should begin to gather, evaluate, and synthesize the information received from dispatch. Responding to a medical emergency for someone complaining of difficulty breathing or coughing up blood will need to be approached differently than responding to a motor vehicle collision with multiple patients. Dispatch can give important information and provide clues that will help prepare the EMT in determining what type of personal protective equipment should be worn, if additional resources are needed, and how many potential patients will be found. As the EMT approaches the scene and the patient, it is important for him or her to continue gathering, evaluating, and synthesizing information as the scene can change quickly. The EMT will need to react appropriately as the scene changes and more information becomes available. Referred to as reading the scene, this is an integral part of the EMT's critical thinking on a call. There are 6 major subcategories to the scene size-up: body substance isolation and standard precautions, scene safety, mechanism of injury and nature of illness, considering spinal precautions, determining the number of patients, and requesting additional resources. The responding crew will need to constantly evaluate the components within these categories as the incident is dispatched, as the crew arrives at the incident, and throughout the entire incident. Remember that all blood, body fluids, secretions, excretions, non-intact skin, and mucous membranes may contain transmissible infectious agents. If it is wet and it comes from the human body, treat it as infectious. It is important for the EMT to obtain familiarity with all available prevention practices when dealing with different patients and circumstances. Guidelines have been developed by OSHA, the CDC, and the Division of Public Health that define universal and standard precautions that focus on the protection of patients and providers alike. Standardized precautions include body substance isolation, personal protective equipment, and the cleaning and disposing of used equipment and supplies. While every situation is different, the EMT must be able to recognize what type of body substance isolation precautions are necessary to maintain a safe working environment. In all cases, hand washing is one of the most important aspects of good BSI. Depending on the patient's presentation and whether there is reasonable risk of exposure to blood, body fluids, mucous membranes, and non-intact skin, the EMT must consider the use of eye protection, gloves, face masks, gowns, and airborne respirator masks such as a HEPA, high-efficiency particulate air, or N95 respirator to protect against transmissible infectious agents. Refer to the Workforce Safety and Wellness session to review what specific body substance isolation and personal protective equipment should be used given various circumstances. Personal protective equipment, PPE, is an extension of body substance isolation, BSI. PPE includes specific clothing or specialized equipment that provides protection to the wearer from substances that may pose a health risk or safety risk. PPE is utilized based on the potential hazard and may require specialized training to employ correctly. Some examples of PPE are helmets, steel-toe boots, self-contained breathing apparatus, leather gloves, utility gloves, heat-resistant outerwear such as firefighting turnout gear, and high-visibility vests. In November 2008, a new federal regulation went into effect mandating that anyone working in the right-of-way of a federal aid highway must be wearing high-visibility clothing that meets specific requirements of the American National Standards Institute, ANSI, and the International Safety Equipment Association, ISEA. This mandate applies to all emergency responders with certain safety exceptions. The rule in its revised form states that all workers within the right-of-way of a federal aid highway who are exposed either to traffic, vehicles using the highway for purposes of travel, or to construction equipment within the work area shall wear high visibility safety apparel. Firefighters or other emergency responders working within the right-of-way of a federal aid highway and engaged in emergency operations that directly expose them to flame, fire, heat, and/or hazardous materials may wear retroreflective turnout gear that is specified and regulated by other organizations such as the National Fire Protection Association, NFPA. Firefighters or other emergency responders working within the right-of-way of a federal aid highway and engaged in any other types of operations shall wear high visibility safety apparel. While this provision applies to federally funded highways, it can sometimes be anyone's guess as to whether or not federal funds are used to pay for a specific stretch of road or highway. Additionally, while firefighters are denoted specifically within the regulation, non-firefighter EMS providers are indeed covered by the mandate as well. Simply stated, if working on a road with vehicular traffic, EMS providers should be wearing reflective clothing or vests. A brief definition of scene safety would be an assessment of the surroundings on an emergency scene to assure the well-being of the EMT, the patients, and bystanders. In the pre-hospital world, EMS providers work in unpredictable and sometimes unstable environments. Each scene varies greatly and produces circumstances that necessitate the EMT to constantly check for potential problems or hazards. Do not assume that a scene is safe because other responders are there before you. You should always execute your own size-up. Remember, one of the EMT's first responsibilities is personal safety and the safety of the crew. EMTs have the duty to keep themselves safe to ensure they can indeed help others. If the scene is unsafe, make it safe. Otherwise, do not enter. Safety issues can arise at any time and range from weather conditions, environmental factors, bystanders who are directly or indirectly related to the incident, scene locations, equipment encountered, and yes, even the beloved pet, no matter how small it may be. Weather plays a role during every incident. Extremely cold or hot temperatures can cause equipment problems or failures. Extreme temperatures can present dangerous situations to both the patient and the crew. Ice on sidewalks, snow drifts, and rain-slicked roads are common hazards in Wisconsin, impacting patient movement and transport. Inversely, high humidity and extreme heat can quickly dehydrate rescue crews as well as their patients during an incident. Depending on the weather conditions, some of the assessments and interventions performed by the EMT will need to be tweaked or adjusted to ensure the safety of all parties involved. Quite often, the EMT will respond to situations that involve a crime or potential crime. Safety is still the #1 priority when approaching this type of incident. In some cases, dispatch will provide information regarding an unsafe scene. If that is the case, it may be in the EMT's protocol or policy to stage the ambulance and wait until law enforcement has secured the scene. If the EMT enters a scene that becomes unsafe, it is important that the EMT retreat from the scene as quickly and safely as possible. It is important that the EMT always have an escape route. If possible, position your body between the patient and the exit for easy egress if necessary. Having an emergent code word or phrase is another tactic some crews use to rapidly clear the scene given potential violence or safety issues. Over time, an EMT can develop a sixth sense of sorts when responding to emergency calls. Be alert to clues for potential violence at a scene, such as loud voices and fighting, unusual silence, complete darkness, big crowds, visible weapons or items that can be used as weapons, and signs of drug or alcohol use. Knowledge of prior violence at a particular location or with a known individual should also be a red flag for the responding crew. There can also be the potential to encounter toxic gas hazards or related situations. For instance, what may appear to be a routine medical call with a patient complaining of flu-like symptoms may actually turn out to be a carbon monoxide poisoning situation. It is important to look at all the possibilities and potential causes at every incident. Keep a watchful eye for posted placards, be aware of unusual sights or smells, and scan the scene for escaping liquids and gases. If a chemical release is identified, make use of resources like the Emergency Response Guidebook, ERG, or agencies such as Chemtrec, the Chemical Transportation Emergency Center, to formulate an appropriate response. Typically, the EMT receives their initial training in a well-lit, climate-controlled classroom, which is in stark contrast to an average emergency scene. Repetition of skills during continual, ongoing training should provide the necessary framework and foundation needed by the EMS provider to handle many of the unstable environments encountered in the field. When approaching accident scenes, it is important for the EMT to establish potential danger zones when positioning and responding emergency vehicles for a safe approach to provide overall scene protection and to ensure easy egress from the scene. The general danger zone for incidents involving downed power lines should extend at least one full span between utility poles from the nearest unaffected utility pole. Position emergency vehicles upwind at least 100 feet away from burning vehicles or other objects that pose no other apparent hazard. If other hazards are involved in an incident, it is imperative the EMT utilize the current issue of the Emergency Response Guidebook, ERG, to establish safe distances from the event. More information on utilizing the Emergency Response Guidebook will be available during the EMS Operations section. In addition, your service should have specific protocols pertaining to hazardous materials incident responses. One of the attributes that commonly separates the veteran EMT from the new graduate EMT is the ability to remain calm and function coherently under extreme pressure. The fight or flight response is the body's physiological reaction to stressful situations that involves activation of the sympathetic nervous system. Adrenaline is released in the body, which generally heightens the EMT's sense of sight and hearing while increasing the responder's muscle strength and reflexes. Unfortunately, this fight or flight response can also impair the EMT's critical thinking skills and his or her ability to focus, so it is important for all EMS responders to develop systematic habits of evaluation and management that can be applied to every patient and situation they encounter. The first rule in the size-up process is to stop, think, and take a breath. In the midst of whatever chaos exists on the scene, it is important for the responder to remain calm, collected, and in control. Scan the situation and work in a systematic manner. Crucial pieces of information will be missed if steps in the assessment and management process are ignored. A child lying in a roadway after being struck by a car is stressful enough without adding a nervous or stressed responding crew to the scene. Scan the situation, decide, and then act. The EMT must be confident and steady in his or her approach. This is an achievable goal if the responder is knowledgeable and has prepared for any circumstance. The EMT should maintain control while continually reevaluating the circumstances and reacting appropriately. The EMS professional is similar to a conductor in an orchestra or a director in a movie. Individual pieces of the puzzle will not be effective unless they are brought together for a finished project. It will be necessary for the EMT to multitask throughout the entire incident while maintaining composure with a diligent eye on safety. Mechanism of injury, MOI, is the force or forces that caused an injury or a potential injury to a patient. Trauma occurs to the body when the body's tissues are exposed to energy levels beyond their tolerance. Mechanism is determined by visual inspection of the scene and by interviewing the patient, bystanders, or family members. Mechanism requires the EMT to look into their magic crystal ball of sorts and predict what types of injury patterns are possible based on the forces that were applied to the body. This is an educated process based on the EMT's knowledge of physics and kinematics of trauma. The EMT should look at the big picture while also looking for subtle mechanisms or little clues that could impact the patient's well-being as well. As more information becomes available regarding the applicable MOI, the EMT must apply the information to his or her patient assessment and subsequent interventions. As opposed to MOI, which looks at patient trauma, nature of illness, NOI, is associated with medical conditions. The nature of illness is defined by any non-traumatic condition that is or has the potential to impact the patient's health at the specific time. The patient's chief complaint or complaints will be a good starting point for determining the nature of illness. Interviewing the patient, family members, and bystanders will provide the EMT with clues as to what the patient is or has been experiencing. Examining the scene can also assist in determining why a patient is presenting a certain way. Finding an empty bottle of pills near an unconscious patient, for example, is important information that will need to be considered by the crew and shared with the receiving facility. While the empty bottle of pills may or may not be related to the immediate problem, the information has the potential to be very pertinent and must be considered by the crew. Dispatch can provide clues regarding MOI or NOI to the EMS crew as well. It is important to remember, however, that dispatch information is only a small piece of the big puzzle. Dispatch will not always have all the information or may have received incorrect information from the caller. For instance, dispatch may indicate a 20-foot fall from a ladder, which leads the EMT to think immediately about MOI. Upon evaluation and interview of the patient, however, it may become apparent that a NOI was involved as well. Say, for instance, that the patient became lightheaded, which then caused the fall. Acquiring that additional information would modify the EMT's initial patient management and treatment plan, as this patient not only suffered a traumatic injury, but it may have been precipitated by a medical condition that also requires attention. When discussing MOI, considering spinal precautions early in the size-up process can prove very beneficial in providing rapid, effective patient care. Considering spinal precautions is just that, however, a consideration. Once an EMT reaches a patient, it will be necessary for the EMT to rule in or rule out the need for spinal precautions on both medical and trauma patients by interviewing the patient and bystanders to get the story. If the EMT cannot obtain enough of the story, or if some of the circumstances are unknown, the EMT should always err on the side of caution and take spinal precautions. Determining early in the size-up process how many patients may be involved will help in the assessment and care of the sick and injured. If there are more patients than the responding agency can efficiently accommodate, it will be necessary to initiate mutual aid or a mass casualty plan depending on the number of patients actually involved. When dispatched to a motor vehicle collision involving a school bus full of children, for instance, the responding agency can request additional resources even before arriving on the scene. There are also instances in which an EMS crew responds to a medical emergency and winds up with more than one patient. For example, the EMT may be responding for a pulseless, non-breathing elderly male and, upon arrival, find his wife also complaining of chest pain and difficulty breathing. Immediately, this new information changes the required approach to the incident. When addressing multiple patients, especially in a mass casualty situation, triage is the process of prioritizing the patients for treatment. More information about triage and the incident command system is available in the EMS operations module of this course. The need for additional resources can vary based on the patient or situation. If the responding agency requires more ambulances and EMTs to care for patients than available within the service, mutual aid is initiated to request those resources from other nearby providers. Weather conditions can create ice and other hazards on the roads, so the Department of Public Works might be needed to salt or plow roadways. A critical patient may require advanced life support to adequately treat him or her, requiring the need for a paramedic intercept. Limited access to scenes may require ATVs, boats, or special equipment trucks to respond. Law enforcement may be needed to help with crowd control or crime scenes. The fire department may be needed for patient extrication from a vehicle or building. These are just some of the additional resources that may be required by EMS personnel at an emergency scene. When possible, it is helpful to obtain additional help prior to physical contact with patients because it may become difficult for the EMT to realize the need to request additional resources once engaged with a patient. Now let's put the scene size up into practice. Please feel free to pause this presentation at any time to consider the questions posed. You are being dispatched to a private residence for a 56-year-old male patient complaining of shortness of breath and chest pain. With that information, please answer the following questions. What type of PPE or BSI do you think is needed for this incident? What obvious hazards or scene safety issues, if any, can you identify? What hidden potential hazards can you identify? Can you identify the MOI or NOI given dispatch information, or is personal observation required? Will you need a crew member to take spinal precautions? How many patients can you see? Is there evidence of other possible patients? What additional resources may be needed for the emergency? How about this scenario? You are being dispatched to a busy highway for a 20-year-old male patient hit by a car while riding his bicycle. What type of PPE or BSI do you think is needed for this incident? What obvious hazards or scene safety issues, if any, can you identify? What hidden potential hazards can you identify? Can you identify the MOI or NOI by dispatch information solely? Will you need a crew member to take spinal precautions? How many patients can you see? Is there evidence of other possible patients? What additional resources may be needed for the emergency? Once you are comfortable with your answers to these scenarios, it is recommended that you speak with your course instructor to see just how you did and to discuss the size-up considerations involved within these scenarios. That concludes the information presented within this module. Given your completion of this module, you should now be able to recognize potential scene hazards, describe common hazards found at the scene of a trauma or medical patient, determine if the scene is safe to enter, define the concept of standard precautions and the need for personal protective equipment, define common mechanisms of injury and nature of illnesses, describe the methods to manage hazards at a scene, discuss the rationale for considering the possible need for early C-spine precautions in the patient assessment process, and explain the reason for identifying the need for additional help or assistance. Please remember to contact your instructor with any questions pertaining to this module. This presentation was created by Waukesha County Technical College with grant funding from the Wisconsin Technical College System.